So we'll go to Anna Houghton. Anna, thanks for bringing up your slides. If you want to turn on your video and sound, I'll provide just a quick introduction. Anna is a research assistant professor in the section of infectious diseases and global health at University of Chicago's Department of Medicine. She is a staff scientist at the Chicago Center for HIV Elimination, where she studies the relationship between social factors and viral spread, which of course is very relevant to the topic today. Her C3.ai DTI funded project aims to adapt that work to COVID-19 using machine learning to identify data elements that are most important to include in modeling to better simulate various scenarios of disease spread and virtually test how different public health or social policy strategies can help mitigate the disease. We're delighted to have you. So Anna, go ahead.
Thank you for the introduction, and I just wanted to thank the organizers of the symposium for inviting me to speak today, and the C3AI for the funding for this project. And also just want to acknowledge my collaborators, co-PIs, and other folks at Argonne National Laboratory, the University of Chicago, and then partners from the Chicago and Illinois Departments of Public Health and the Illinois COVID-19 Modeling Task Force. We've been working closely with those groups since the beginning of the pandemic. So just in terms of background, the COVID-19 pandemic has highlighted alarming health inequities and disproportionate infection rates and mortality in communities of color and other underserved communities. Social determinants of health, or SDOH, are thought to have created heightened vulnerability to COVID via impact on housing, access to care, occupational risk, and underlying health conditions. And so research is needed to better understand the impact of social determinants of health on COVID transmission and mortality, and to develop interventions to address the observed inequities and for future pandemic mitigation. So agent-based models are computational models that allow for examination of the complex processes by which social determinants impact COVID-19, and they can illuminate system-level consequences of the behaviors and interactions of individuals and test potential interventions. They're a perfect tool for studying the impact of social determinants on COVID-19. So the aims of the project were to extend and expand an existing agent-based model of local COVID transmission called CityCOVID. We combined multiple data sources to develop a detailed synthetic agent population, which incorporates social determinants of health and their impact on transmission dynamics. And this results in a more realistic synthetic population from which we can evaluate potential interventions under more realistic or real world scenarios. And we can compare intervention effects across population subgroups and contexts. So we use the ecological systems theory as a framework for understanding multi-level influences on COVID-19 outcomes. And so within this framework, individuals have characteristics, engage in behaviors, and interact with other individuals at the micro level, but they do this within physical, social, and healthcare environments that impact the risk associated with certain behaviors or activities. And then, and so the intersection of these interactions lead to risk for COVID. And then all of these things are situated within and influenced by the larger macro level environment, which are things like social and political systems that create and influence inequities, and they are sort of distal drivers of health outcomes. So this is the framework for development of the expanded synthetic population. So Argonne has been working with the state and local health departments since the beginning, since early in the pandemic in Chicago. So CityCOVID is a stochastic agent-based model containing 2.7 million agents representing the population of Chicago. And agents engage in behaviors, respond to disease and health interventions, interact with one another, and move from place to place according to specified activity schedules. So within the model, transitions between disease states are dependent on agent attributes and exposure to infected agents through co-location, place-based risk, and protective behaviors. So the model parameters are calibrated to COVID-19 death counts and hospitalizations from local Department of Health data. And this is possible through use of high performance computing resources at Argonne National Laboratory that allow for large scale experimentation and generation of the synthetic population. To build the synthetic population, we harmonize data from multiple sources to derive distributions of agent characteristics and use statistical techniques such as iterative proportional fitting and MCMC algorithms to make sure that the synthetic population is statistically representative of the population of Chicago. And data sources and descriptions are showed in the table to the right. These included national level data sets, so data from the US Census Bureau and the Bureau of Labor Statistics, as well as existing population synthetic databases, and activity schedules were based on the American Time Use Survey and the panel study of income dynamics. And then we also incorporated local data from the Chicago Department of Public Health on the prevalence of chronic conditions such as cardiovascular disease, asthma, obesity, and then case counts and hospitalizations and mortality data came from the local health departments as well. So activity schedules are also updated based on the expanded set of parameters, which include social determinants like housing factors and occupation. So this is the diagram of the epidemiologic part of the model, and agent attributes impact activities, co-location patterns, and potential exposure, as well as transition in disease states. So, factors like occupational risk, for example, would affect the probability of exposure, here in the the sequence, and then factors like age and comorbid conditions can affect the probability of symptomatic disease and severity of disease. And then factors such as, again, comorbid conditions and age, also hospital attributes and other factors can affect the probability of moving, of being hospitalized, and the probability of recovery for those who are hospitalized. So the social determinants factors affect state transitions along the the continuum here, and that's how we implement the impact of social determinants on COVID transmission in the model. So it's both through the impact on activity patterns and co-locations, and then also on these disease state transitions. So here I'll show some initial experiments that we've done with CityCOVID. So this was looking at the impact of changes in protective behaviors, so masking and social distancing, for example, among adults under different school reopening scenarios. So we were looking at epidemic trajectories to try to determine the relative impact of school reopening and more widespread either reopening or behavioral changes among adults. And so horizontally from left to right are the reductions in protective behaviors, and the yellow are new infections, and the orange, red color are hospitalizations. And so, and then from top to bottom are the effect of school reopening. And the results indicate that reductions in adult protective behaviors had a significant impact on the downward trends in new infections and hospitalizations that were seen from sort of April to June, and then through the fall. And this was particularly true when accompanied by higher levels of school reopening. So, so the changes, if we go horizontally across the rows, seem to be larger than the changes we see when we look vertically from top to bottom. So it looks like the changes in protective behaviors are contributing more to these epidemic trajectories. And then we also looked at changes in out-of-household activities among adults. So maintaining a certain level of protective behaviors, but just increasing, for instance, mobility, or increasing reopening, things like that. And then again, on the vertical axis we have increases in school reopening. And again, we see that increased school age activity levels had relatively little impact on overall transmission when adult out-of-household activities were reduced. So these are the vertical figures, whereas increasing adult out-of-household activities resulted in a reversal of downward trends in all school scenarios. So in each row, there was this sort of reversal of the trend by by, this is January 2021. And so increases in out of household activities among younger adults could result in reversals of downward trends, particularly if combined with decreases in protective behaviors and more widespread increases in school inactivity levels and school reopening among younger children. So, so these were some of the early experiments that were possible through the model, and were also used to guide local planning and policy decisions in collaboration with the local health department. But this version of the model did not incorporate additional heterogeneities in terms of race, ethnicity, occupation, or other factors that could potentially impact the degree of out of household activities, or the the level of protective behaviors. So, so for next steps will be to rerun some of these experiments and others using the newly expanded synthetic population. And we hope to have results to share from that work over the next couple months. So I'll just describe our ongoing work and next steps. Some of the questions we want to evaluate with CityCOVID include trying to better understand the mechanisms that explain racial and ethnic differences in transmission and mortality. We're particularly interested in occupational risk and how overrepresentation in occupations that limit ability to practice social distancing, that don't allow for working from home, such as essential industries and public-facing jobs, impacted the early disparities that were observed. We're also interested in looking at housing-related factors like housing density and housing composition and quality, as well as homelessness, and the impact of those things on the epidemic, as well as others. So the model provides a flexible platform once we've incorporated the additional agent characteristics to test various hypotheses about what factors may have driven observed disparities by comparing historical trends in the model with trends from empirical data. And then the ultimate goal is to evaluate what interventions would be most effective and their potential impact across different contexts or settings. So for instance, thinking about how workplace or employment-related interventions could be most effectively deployed, and with vaccines now available, how can we prioritize vaccination based on either individual characteristics, co-location patterns, and/or area-level attributes. So we can evaluate the potential impact of various strategies for increasing vaccine uptake in the population as a whole, and also in subsets of the population who may be particularly vulnerable. And so we are excited to test these hypotheses and interventions in next steps. So that is all I have for today. I'm happy to take questions, and thanks again to the to the organizers.
Thank you, Anna. So we have 1 minute and we have one question. So the question is, did you try to validate the impact of some of the socioeconomic and demographic factors from real data? Also a question about the effect of comorbidities.
Yes, so we did, so we are using real local data to validate the model and but we both make sure that the distribution of characteristics in the model match the characteristics of the population of Chicago in terms of the socioeconomic factors and also the comorbidities. The process also accounts for correlation among the attributes. So there's obviously correlation between the different comorbidities, as well as correlation between income, race, ethnicity. Many of the social determinants have strong correlations. So the approach accounts for those correlations, and then we do statistical tests to evaluate the fit of the synthetic population to the data, and then also conduct some model calibration to make sure that the model data is as close to what we know about reality as possible.
Great, thank you. Thank you for your work. And so Professor Hutton has her contact information here on the final slide. If you want to take a look there, I'm sure she would be happy to follow up with any questions.